Welcome, everyone, to a brand new episode of the Preventive Medicine Podcast. It has been a minute, but we are back, and today we are talking about pediatric related injuries, which is pretty unique. And today we are joined by Dr. Kevin Walter. Dr. Walter is one of my attendings that I work with during my residency, and he is phenomenal. He's also one of the nicest people you will ever meet. Dr. Walter is currently the medical director for children's and adolescent medicine at Children's of Wisconsin. He is also a associate program director for the Sports Medicine Fellowship at the Medical College of Wisconsin, as well as an associate professor at the Medical College of Wisconsin. And he's done a lot of stuff. I'm not going to talk over everything, but he's also published quite a bit on a variety of things related to children's health when it comes to sports-related injuries. He's also an advocate for things legislature-wise in the local, state, and national level for safety in youth sports. So without further ado, let's get into the episode. Welcome to the Preventive Medicine Podcast. Help us change the paradigm of medicine from keep people alive to help people thrive, one episode at a time. And now, here's the show. All right, everyone, welcome back to the show. Today, like I said in the introduction, we have the one and only Dr. Kevin Walter here with us today, and he has a lot to talk about, kind of a little niche field. So welcome, Dr. Walter, to the show.
Thank you very much for having me. I appreciate it.
Of course. Yeah. The first question that we have kind of to everyone that comes on to the show is, what does preventive medicine mean to you, and how do you apply that to pediatrics?
All right. So preventive medicine, and this is probably the usual answer you get. Like to me, it's being proactive. And so you're looking at preventing health issues before they happen, and so by having a better lifestyle, by um looking ahead and adopting strategies for life, be it nutrition, exercise, etc. In theory, you can decrease the risk of disease and injury, which then improves your overall lifespan and quality of life. But I think probably also is like a broader focus than just me as an individual. Certainly that's important, but for pediatrics, you've got to think, well, family as well, because if I'm a 13-year-old kid. I don't control the purse strings. I don't go shopping for groceries. I don't have the money to join a gym or pay for county park fees or things like that. So it's got to be broader than just the individual. You've got to focus on family. You've got to think about community. And even thinking, broadness, it's not necessarily just physical health, it's physical, mental, behavioral, socioeconomic wellness for all of those things. So I think, oh, go ahead.
No, I was going to say, obviously, you talk about, at first, it's obviously all these basic things that we talk about prevention that we get a lot of answers for, but then applying to pediatrics, you have to talk to the parents too. So it's kind of like two parts of the job, because you have to talk to the kid, make them maybe understand if they can at that point, because they don't really see the side effects of a lot of these things like when you get older, but then the parents as well. So do you feel like that's more challenging than the actual child part?
Absolutely. Absolutely. I mean, just speaking for myself, right? I am a creature of habit. I've developed these habits over time. I have that kind of intrinsic thought of what's right, what I'm willing to do, where I'll step out on a ledge. And it can be hard to break those habits and thought patterns. So the challenge in pediatrics is exactly what you said. When I'm in a room, I've got to speak to the kid, but also speak to the parent and try to do them both at the same time at a level they can understand. And know that because the kids are not in complete control, you've got to kind of convert the parents to adopt this more preventive mindset. Um, the positives of that, if you can get through, is these kids start to develop good habits early in life, and then hopefully good habits early in life and adolescence become continued good habits as you age and become an adult. Lifestyle, hey, I'm not smoking, I exercise more, I go to medical visits regularly, again, but the challenge is if the parents don't buy in, it's going to be really hard to get the kid to buy in for their future.
Definitely. It's kind of like that cycle what you're describing where the kid grows up and then they have their own children and it kind of continues on, and that's that community aspect of preventive medicine. But I want to ask you, pediatric sports medicine is a pretty niche field. Like unless you have a kid that's breaking a bone or gets involved in sports to some extent, you're not really seeing someone like yourself. What led you to this field?
Oh my goodness. So weirdly enough, I'll tell you I feel like for us in medicine, right, there's a lot of people that have an origin story. A relative was sick, I got hurt, I saw the medical field firsthand or secondhand, and that's when I knew what I wanted to do. Um, I have an older sister that went to nursing school that's about 14 years older than me. Otherwise, I have no one medical in my family. But I just always wanted to be a doctor to the point where in fourth grade, and this is totally true. It sounds like it's a lie, but it's totally true. In fourth grade, after I got married, my mom dropped off boxes of stuff like, here, get it out of my house. And now it's in your house of all the stuff. And apparently she was a hoarder because they were like receipts from the crib and congratulations on being pregnant type stuff. But as my wife and I were digging through, there was that fourth grade paper, my name is Kevin Walter, my favorite color is this is my favorite food, what do you want to be when you grow up? And it was video game designer or sports doctor, and I have no idea how I thought of that. um, but it turned out to be true. But the real answer is, as I've always wanted to be a doctor, in medical school or going into medical school, my assumption was that I would be orthopedic surgery. That's what I was kind of angling for. With my sister being a nurse in the OR, if I had an earache, she would pull me in and I would see ENT. When I cut my, scalp, I saw plastics to do stitches. So I saw primarily medicine as this surgical specialty um, pathway. Then as I went to med school, I'm old, so it was 2 years of all classes and 2 years of clinical. And my first clinical session was pediatrics, and I absolutely loved it. So I wanted to be an orthopedic surgeon, and if that didn't work out, I'd be a pediatrician. And then as I went by and you did more surgical stuff, it was general surgery, then peds, urology, then peds, plastics, then peds, back to ortho, then peds. Peds always was number two, but the first specialty kind of changed around a lot. And it was August of my fourth year, and I was doing ironically enough, a sports medicine rotation, and I really came home, sat down, and was like, I do not like being in the OR. Not that I don't like doing procedures, not that it was creeped out or grossy, but it's just was not my bag. I like obviously to talk, and I like to interact more with patients, and I realized that I didn't like the kind of fast, quick visit pace and clinic days that surgeons had. So I finally was honest with myself and said, "Hey, I don't want to be a surgeon after all. I don't like all these things about it. I'm going to go do pediatrics." And so I went into peds with the thought of, "Hey, they're kids, they're healthy, they're going to play sports. I'll try and take care of these high school athletes." And I didn't even know I could do primary care sports medicine with it. And then in my second year of residency, when I was trying to figure out what to do, I accepted an extra year as chief resident, and I found, and I'll name drop him, Dr. David Bernhardt out at UW Madison, who was a pediatrician that was doing sports medicine. And I was like, mind blown. This is the greatest thing in the world. And he was kind enough to stop my incessant phone calls and emails about, can I come out there and do an away rotation with you? And I loved it. And then I got lucky enough to go fellowship and then come back to Children's Wisconsin and Milwaukee and develop the program. So everything kind of fell into place. But it is pretty niche. When I got my board certification, I think I was 94 or 95 um, for pediatric sports medicine docs in the country. So there's much more now. But back in the day, it was even more niche.
Definitely. And I'm glad you chose this route because that warm, like caring voice that you have and the ability to talk to people would have been wasted in surgery. Because obviously I've been in an exam room with you and hearing you talk to the patient, the family members, it's much better in that way than in a surgery kind of clinic visit. So glad you chose that, and also gives me the opportunity to learn from you as well.
Yes,
When
I
it
would have
comes to
been the
sports medicine,
slowest surgeon in the world. Oh my goodness.
clinic would have been going till like 8 p.m. every day just because it would have been like 30 minutes with each patient.
Exactly.
So obviously you have some experience on the adult side when it comes to sports medicine from like rotations and whatnot, but obviously now you do mostly children's. What are the biggest differences between adult and children when it comes to something like sports medicine?
So one of the coolest things about sports medicine is as you go through fellowship, like technically I am certified to see from zero to, birth to death. I can see all ages. But training as a pediatrician, I knew that I always wanted to bring my practice down to that college and below age just because it's where I'm more comfortable. And I really think looking at that age, it's more how do I know that chronic leg pain um, is not something bad like leukemia. I feel more comfortable figuring that out in younger people, whereas how do I know acute shoulder pain could not be an MI? And that would make me a little more nervous because it's been a long time since I've done that. So as we look at differences, I think one of them is types of injuries. Younger people are much more likely to injure bones than adults. Adults are more likely to have tendonitis and degenerative changes that we don't see in kids. I think as you look at kind of psychosocial aspect of it, the pressures that younger athletes face are different than we do as adults because you've got school and sports and you need to sleep and you need to be social. You've got coaches pushing you to return, parents pushing you to return, teammates pushing you to return. So how do all of those things interact? Um, and affect recovery because that increased stress definitely we see it in clinic often has a negative impact because kids get really anxious about it. And then as we look at treatment, I think that the tendency it's more frequently adults will lean toward injection. If I have elbow pain, taking me out of work for 2 months to recover is not going to go over very well. I'll lose my house, I will lose my car. So, get the injection and move on. And the hard part with athletes is they see that happen at the NFL level, at the NBA level. Let's just get the injection and keep playing. So if that's best practice at that level, then we should do it for youth sports at the age of 10 or 15 or to keep me playing varsity. And that's usually the wrong idea. Um, so there's some trickle down on the adult side, but I tend to push, or from the adult side, but I tend to really push hard and say, pediatric, we want to use injections as a very much last resort. But then one of the other things that I think is interesting is you start looking at activity, because if we think sports medicine, um, a lot of people will think about pro sports. Like, oh, if you're a sports doc, you're going to take care of a big D1 college or a professional team. And by all means, yes, people do that. But there's a lot more high school teams, there's a lot more youth leagues. So the number or the proportion of younger people participating in sport is definitely higher than the proportion of adults. And to the point where if you look at like CDC, probably only about a quarter of us are meeting like the physical activity guidelines recommended by CDC, which is I want to say it's 150 to 300 minutes a week of moderate cardio or cut that in half, right? 75 to 150 of more vigorous cardio or combo moderate to vigorous. Um, Kids, on the other hand, if you look at the 2022 data, and I got to check my notes here. So it's the National Survey of Children's Health, 2022, 6 to 17-year-olds, we had 54% participating in organized sports. So that means about 27 million kids played sports, which is awesome. But it also means about 23 million did not, which is a lot. And that number has gone down since the last survey in 2017. And I think we could probably, pandemic probably knock that down. There's various reasons. But I look at it and I think, yes, proportionally, there's more kids that are active with sport, but it's still not nearly enough. There are still a lot of kids that need to improve their physical activity. And sorry, I
Definitely. You brought
hijacked
up,
that question and took it in
yeah,
a
no
different
worries.
direction, but
You brought up a lot of different great things in there, and some of those we'll discuss a little bit later, like the psychological aspect of sport, which is huge, especially in pediatrics. I don't think we as adults realize what a lot of kids are going through because we just kind of grew through it. So we'll touch on that in a little bit. Then I also love how you quoted the ACSM. I don't know if it was actually the ACSM that you quoted specifically because there was children's modification or whatnot, but I love how you quoted that. I quote that very frequently. So nice memory there. But as far as kind of things that you see in clinic with this many children playing sports and this many children not playing sports, do you tend to see yourself more of them at the population that are playing sports, or is that the population that you're seeing in your clinic?
So I look at sports medicine, and again, when we think of from the outside looking in, it's taking care of athletes. And even medically, I have people think that, like, oh, if I got hurt in gym class or on the playground, that's not sports medicine. But I look at it as this is more musculoskeletal medicine. If you are injured during doing activity, I don't care if you are running around in your yard or playing on recess. Or even playing the saxophone for school band, like yes, that is sports medicine to me. I want to see you in clinic because I want you to continue that activity. And I think my unique background and training kind of positions me to help you do that. Whereas many primary care docs that don't have the musculoskeletal and sports medicine experience, the tendency is to say, oh, you're hurt, just rest for a few weeks. And that stinks because then kids either rest and they're like, hey, being lazy is not a bad deal. I can play more video games. I got out of shape. It's hard to get back in. And then that kind of unplugs them from sport and they may not never come back in. Or they say, this is for the birds. I'm not resting. This is my life and my friends. And they just plow through and develop worse injuries. So I think being able to have that perspective of, yes, I'll take care of any injury, no matter where it came from, because I want to try and keep you active as long as it's safe.
Sure. And one of the injuries that I see commonly in your clinic, well, working with you, is concussions. And we're going to jump around that outline that I gave you a little bit here. But concussions are pretty common from what I'm seeing now. I fortunately never experienced one. So I guess I'm lucky in that regard. But they're extremely common. A lot of people hear about concussions, but don't really know what they are. So, number one, what are concussions? And then we'll kind of go from there because there's a lot to extrapolate as far as concussions with children. So, let's start with there. What is a concussion? And then how many can you have as a kid?
Yeah, that's a hard question. So concussion, technically, I'll say it's a mild traumatic brain injury, and I'll explain it like I do with families because medically speaking, if you want to geek out, there's the neurometabolic cascade of MTBI and great animal-based model research looking at neurotransmitters and sodium potassium pump and all of that stuff. That's interesting, but a lot. Simplistically, it's a functional brain injury. So it's not necessarily bleeding, bruising, swelling that you can see on MRI or CT, advanced neuroimaging. It's a disturbance with how your brain works. And long story short, it slows the communication of the nerves down and impairs that communication. And it alters cerebral blood flow a little bit and it alters energy use in your brain. So you get low energy availability, slow moving brain that makes you feel bad as you're trying to use your brain. And so here comes symptoms, headache, dizziness, nausea, fogginess, etc. Now, I expect that to gradually improve as you begin treating it, and I expect it to completely go away. So it is unusual for um, a first, second time concussion to cause lifetime or long term problems. When you have many, many concussions, that can be an issue. And that gets to your question of how many can you have? Whew, it's pretty variable. And I'll give you an example because this is where concussion to me is is fascinating, and the field and the science behind it is growing so much. But I took care of a kid a few years ago that he lowered the hoop in his driveway and was dunking with his buddy, and his buddy came in underneath him, undercut him, and he flipped and came down on his head, knocked out, post-traumatic seizure, wound up in the ICU overnight. I mean, as a parent, horribly alarming. Went from ICU to step down ICU. Within 2 days, he was out of the hospital and 100% symptom free, totally back to normal. So, super alarming presentation, but really quick recovery. Um, I saw another kid that same day that was playing basketball and was looking to the left and took a hard pass to the side of the head from the right, didn't see it coming, had headache, dizziness. So we said, yes, this is concussion, but those symptoms persisted for nearly 6 months. So here you've got an alarming presentation that recovers within 24 to 48 hours. Another one where you're like, yeah, that may not even be concussion, but it lasted, or that wouldn't give everyone a concussion, but symptoms last 5.5 months. That's the problem with going only by numbers. Those are two very different stories. And how do you try and bring that stuff together to say, is it 3 concussions, 5 concussions, 2 concussions, which is when we should pull the plug and alter sport? So it's
So
pretty
it sounds like
unique.
Yeah, it sounds like the symptoms are very variable, depending from kid to kid. Some people might have just a little bit of a headache, a little bit of nausea, maybe, and then all the way to having seizures after some sort of traumatic injury where they like land on pavement or something like that. So, as a parent, I'm not a parent myself, but if there are parents out there who are listening to this, the question comes up like, how do I know if my kid had a concussion? Because a lot of times, like you said, kids are playing around in the driveway. I've definitely lowered the hoop myself right now as a 30-year-old, but a lot of times these things aren't seen, and the kid comes in and they're talking about, oh, I have a little bit of a headache, I hit my head on the ground. How does a parent know that this is a concussion, something needs to be done about this? Because we know, in obviously if you get a second concussion or a second traumatic brain injury right after the first one, and then worse, if you get another one, it kind of worsens the prognosis. So how do you as a parent know that this is a concussion and to get seen and to do something about it?
It can be hard. And I push parents, and I think this is a similar thing for coaches. I don't expect you to necessarily diagnose the concussion, but I expect you to have an index of suspicion. So if there is a head impact and then any symptoms, headache, dizziness, nausea, come on after that, that's when you've got to think this could be a concussion. Therefore, I need to protect you as a child or student athlete, remove you from play. So if it's in the driveway, I'm bringing you in, having you sit down. If it's on the soccer pitch, I'm bringing you to the sideline, hopefully sending you to the athletic trainer. So you've got to have that index of suspicion, but it's head impact followed by symptoms. And thankfully, I'll toot our state's horn in Wisconsin, the WIA, the High School Association. If you go to their website, you can find beautiful information on concussion, signs, symptoms, what do you do, how do you get back to school, all on that website.
So that resource will be down below, as well as some of the references that Dr. Walter's talking about. Can you talk a little bit about what that second impact syndrome is, why it's important to prevent another hit, and why you care so much about even like mild quote unquote symptoms, like a little bit of a headache?
Yeah, so the way that I like to phrase it is with concussion, you have to be 100% recovered. If you're 98% recovered, then your risk of repeat injury is pretty high. And if you get, like you said, those back-to-back injuries, worst case scenario is second impact syndrome, which is think of it as your brain is already not working right. You get another impact, it dysregulates more. Here comes swelling, bleeding, dysfunction. Those are the horrible stories where we read about people who die or have brain damage, etc. Um, can't predict who, how, why, or when. It's pretty rare, but if you're one of those, one in a few hundred people that get it or one in 1,000 people that get it, it's terrible. So we want to avoid even entering into that conversation at all. More commonly, if you get concussion and then head impact on top of it, it worsens your symptoms. So you get an exacerbation of symptoms, it prolongs recovery. So now instead of 75-ish% of adolescents will recover within a month, now you get that other one and it drags you into over a month. And that stinks feeling bad that long. That takes you out of the life and things that you want to do for a while, and it just kind of complicates recovery. The other thing that we worry about when you're getting these close together concussions is clearly we know more concussions is not better. We don't know, as we talked about before, the exact number. But at some point, if we say, hey, you had 2 concussions within one season, you probably need to sit out the rest of that season from full contact, or maybe even longer. And that's where the science is trying to help us figure out, like, what's the ideal timeline on how long do you need to be out to make a difference in your overall risk profile.
Sure. Now, as once again, as a parent listening to this, you might hear something like second impact syndrome and hear, whoa, death from like a brain injury, blah, 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 all these severe things. And then you think about your kids running around the summer playing with someone in the neighborhood. You don't know what's going on. And in the name of prevention, is there a thing that parents can say to their kids as far as preventing these? Or is it just like, let kids be kids and we have to be vigilant about kind of noticing if there's symptoms or asking our kids how things went, stuff like that?
I think it's communication. Talk to your kids, see how they feel, see if they had injuries. Um, if they are older, a lot of states now will have a form that you have to fill out before you go to a club sport or a school sport that gives you information on concussion. And I would encourage families, don't just blow it off and sign it. Like, it's not, when you get I signed up for this app and you have to click on, I forget the name of it. I'm blanking on it, but
Just
that thing
agree
that
to
you have to,
terms and conditions to
yeah,
give away
terms and
everything.
thank you. Exactly. And you're like, oh my gosh, this is so long, just click and go. For the concussion form, that's a good opportunity. Sit down with your child and run through it and read it so they have an understanding of signs and symptoms and what to do. You do. And then as you talk to kids, if you see a kid hit their head and you say, hey, how you doing? More often than not, they're going to be like, oh, I'm fine. But you've got to dig in and ask them a little bit more. So it's a lot about communication, and it's a lot about empowering the kids to be honest with how they feel. But yes, when they're out running around, you know, you're going to miss some or you're going to pick some up 2 days later. Um, and that's the way that it goes.
Exactly. You mentioned as one of the side effects of, or a symptom of a concussion, is that you might not be as sharp in school anymore. You might take a little bit more time to learn things, might take a little bit more time to do homework, need some more time for tests. That obviously impacts grades at some extent if you're not given those accommodations earlier on. So, does repetitive concussions or a concussion mean that your kid's not going to be as smart in the future?
Hopefully not. Hopefully not. I think, again, there's evidence out there that shows you that repetitive concussions can lead to long-term problems. So if we look at the research at the professional contact athlete, like American football, um, they have a higher rate of ALS and dementia, Alzheimer's, things like that than the general population. But there's good evidence looking at high school players that they do not have a difference compared to general population or like high school band when it comes to mental health issues or those longer term neurologic problems. So I think a handful of concussions that you treat appropriately, that doesn't necessarily lead to loss of function, loss of intelligence, any other problems. Um, I think if you ignore concussions, mistreat concussions, um, don't seek medical care for concussions, that's where
You're
you'll
still
run
there.
into trouble. Oh, yeah. Did I lose you?
What is going on? Are we still there?
I'm here. You got me?
There we
You
go.
blacked
I'm
out
gonna
for a
pause this
minute.
real
I
quick.
just kept talking. Yeah, yeah.
Yeah, I think my apartment complex has poor internet at times, so it might have just been one of those. But
Yeah.
also my camera is messing up. I'm gonna pause for just 1 second and resume. All right, go for it.
So in addition to long term, I think there's the short term issue of getting back into school because the old school thought with concussion was lay around and do nothing, don't go to school. And we know that's a terrible idea now. That actually prolongs recovery almost just as much as doing too much because it takes you out of life, which is incredibly stressful. So one of the important things that I always push families when I see them is within a week of concussion, maybe the first couple of days, 2, 3 days, it's okay to miss school. But by the end of that first week, I really want you back at school all the time. And your brain's not working right, so we need school to make some adjustments, maybe give you a little bit less work, maybe give you breaks throughout the day, extra time to get your work done, access to tutoring, no PE class. So there's these return to learn adjustments that can be made to keep you at school, keep you in your routine, keep you seeing your friends, keep you learning, and help maintain normalcy in life that will actually help you get better. The American Academy of the American Academy of Pediatrics has a great paper looking at return to learn. It's over a decade old and they're revising it now, so the new one should be coming out soon. But most state associations also have similar things too. And they're just notes that if you're a primary care doc, you can kind of take them and make them your own to help support those injured patients getting back into school as quick as they can.
Definitely. Some of that plays into a little bit of like the psychological aspect that we touched on earlier in this podcast about the pressures on kids, especially like if they do have an injury concussion for academic pressures. But then there's also pressures as far as actual sports environments of getting like hyper competitive with a variety of different sports, becoming the next Tiger Woods, Michael Phelps. What do you think about sports specialization as like a younger kid coming up? And for those who aren't aware, sports specialization is essentially you play one sport like you're playing baseball year round. You're doing indoor in the winter, outdoor in the summer, just so you can get really, really, really good at baseball and hopefully become the next MLB star.
Sports specialization is tough because there's the big push and kind of private club sports to go year round. So back in the day when I was younger, it was football in the fall, you played basketball in winter, did track and field in spring, and then maybe you played baseball in summer. So you were a multi-sport athlete, but you did one sport per season. Now it's basketball over winter, but then you've got a club team, an AAU ball in spring and summer. Maybe you get a little bit of fall off, but you use that for a different league. So if you're a multi-sport athlete nowadays, it tends to be I do a few sports, but I'm probably still doing them all year round. So you're really compounding that overuse. So, but we also know at some point you've got to start specializing. Like if you want to continue to play beyond high school, your focus will need to shift toward one sport that you're going to go forward with in the future. And it's hard to know when that is. And you think back, gymnastics, figure skating, dance, those are often sports where kids are specializing very early because that's just what you need to do to develop that skill set. So it's a balance. And I think it's really talking with people about what are their expectations with sport and helping those things be realistic. And there's Aspen Institute. They have this project play, and I don't know if they coined the term, but it's like the Caitlin Clark effect. So Caitlin Clark, right? You remember her from Iowa. Everyone was watching women's basketball, and she's had a profound effect on girls getting into sport and basketball. But she was a multi-sport athlete. She did soccer, tennis, softball. She played piano, track and field, volleyball, and she kind of credits that to helping her basketball career because every sport you can take lessons, mental lessons, physical skills from each sport, and they can translate nicely to other sports. So I still really push multi-sport athletes within reason, preferably one sport per season. Um, and I think that's the ideal way to go. But that is one of the things that we're going to have to grapple with and try and understand better with sports specialization. And it's a hard one because the youth sport injury is, or the youth sport industry is billions and billions of dollars a year. So there's a lot of money going into that system that will not want to change.
Yeah. When it comes to multi-sport athletes, though, like there's a differentiation between like specialization, just doing one sport all the time, and then multi-sport. But then multi-sport still kind of implies that you're doing some sort of sport essentially all year round, and you're really active, whether you're doing it at the highest level or just doing it at like varsity sports, or you're doing a like a lower level, whatever that may be, recreational. Does that not still increase injury risk, and is that something you should still be thinking about as a parent as far as preventing future injuries? Like we think about a lot of these parents or whoever it is that are in their 30s, 40s now saying, "Oh, I have a shoulder problem. It happened because I was playing all these things when I was a kid and I really abused my body." So is that a concept that would still apply to something like multisport, or you kind of prevent your risk for future injury just by kind of being quote unquote all rounded and using a variety of muscles in those sports?
Oh man, for sure it increases risk because right, risk increases with exposure. So if I didn't do any sports, my risk of sport related injury would be pretty low. So the more you're out there doing stuff, the higher the risk for injury. But I think when you look at multiple sports, like one sport a season, if you play football, then you move to swimming, you're working different parts of your body. So therefore, it minimizes that risk. If you go from cross country to soccer to track where you're running distance, yes, they're all a little bit different, but they're all a lot of running. That kind of elevates that risk. So the conversations that I have with families are yes, doing multi sports helps train your body differently, and that can decrease the risk of injury. But you've got to be thoughtful about what multiple sports are because there's a lot of overlap between sports and it could still contribute to overuse, stress injuries, stuff like that. And then the other thing is also training. So, what I see now with youth sports is when I take my kid to soccer practice, we have 50 minutes to practice before the next team shows up and has the field. So they don't spend 20 minutes warming up and stretching and doing strengthening stuff. It is like 5 minute warm up, just so we feel like we did something. Now let's do soccer skills. So a lot of you sports have morphed to when you are at practice, it is sport specific skills, and they feel like working on flexibility, working on coordination and balance, working on strength, that's something that you need to do on your own time. Whereas before it was rolled into practice and part of the expectation, hey, if I'm running track, we're going to spend a few days in the weight room. Now it's all sports specific. And so you get people that can be very good athletes, um, but muscular control and stability and core is just suboptimal because they've never focused on it. All they do is drill to develop skills for that sport rather than overall fitness. Oh, you froze again.
Yeah. Are you there? We
There,
go.
I got you.
I think we're good. So you were talking a little bit about like these off-season quote unquote now is what we think about, where you hit the weight room, you do like flexibility, all these stability, these kinds of things, and you think that these are the things that really help prevent injuries by building like a muscular base. But then kids aren't getting to be able to do these because, like you said, they're much more sports specific now. Then the flip side of the coin kind of is like, as adults, we think we need a lot of time to recover. We need to do all these supporting things so that we can prevent injuries because we're much more frail as we get older, right? But kids are plastic. Kids can recover from anything. They have incredibly fast recovery times. They can kind of do anything because they're kids. So what do you kind of say to that? Because you have parents on both sides saying, "Oh, why do I need to do all of this if the kid's going to recover anyway? I need to do it because I'm old, but my child is young. They don't need to do it." So what do you say to that?
I usually say, if you don't do it, you're going to be spending more time in clinic with me than you want to. So by doing that stuff, you actually help your child improve their performance, because if you have better flexibility and better core stability and better strength, you'll have better power and agility on the field of play. It will help you reduce your injury risk. So there's less time with me, less time on the sideline. And then it's beneficial as you age, because now, as an old guy, my foundation is better because I worked on it more when I was an adolescent. So I think those are the things that are helpful, and it's just reinforcing. Yes, kids are great at healing, and it's very rare for them to get an injury that will be like career ending. Happens, but it's less common. Um, but they still get hurt. And that's sport. Like, you could be the greatest athlete in the world, highest level of fitness in sport, there's injury risk. And we know that if you're not high fitness, your injury risk is going to be higher, which means more injuries, more time away, more frustration. And then as I take that and think about like preventive medicine and kind of mental and behavioral health, when you get hurt a lot, you get frustrated. And now you're learning that exercise, activity, sport equals pain, injury, frustration. And you start backing away from that and saying, you know what, this is not for me. This stinks. And it actually takes a kid that was initially active and turns them more sedentary, because they learn, if I do too much, if I'm doing activity, I get hurt. Therefore, I need to stop doing activity. And so it can bite you in the butt and move things in the wrong direction too.
Yeah, I think that's a huge point that you just made there about what kids learn from being involved in sports. Because a lot of times, some kids are really interested themselves in the sport, but a lot of times the parents like, "Oh, let's get you involved in soccer, let's get you involved in swimming, whatever it is," and it's kind of like not necessarily a choice for the kids. Sure, they're doing it, but it's a parent that's like, "I want my kid to do this," and then if they get injured, then the parent kind of has them push through sometimes or see a physician. Then the kid learns, oh, sports are a way to pain and whatnot, and it creates this negative spiral for whenever they become adults and can start making their own decisions. So I think that's a huge aspect that you mentioned there. And also to talk about the point of sports specialization a little bit more, I don't know if you're familiar with the book Range by David Epstein, but he talks about how being a generalist or doing a variety of things, like you're talking about Caitlin Clark doing a variety of different sports, actually creates a more strong foundation for future specialization. So for those listeners who haven't listened to that, that will also be in the show notes. That's a great book. We've been talking about sports specialization and organized sports, but what is the age range that we're talking about here? What is too early to start thinking about organized sports? When would you recommend a parent or someone else to start talking about organized sports?
I, there's dance that starts at 3 or 4. I really think it's not necessarily an age, it's more expectation. So think about like, what do your kids want to get out of sports? What do you want them to get out of sports? Um, Having that healthy expectation of, I want to do sports because I want to be part of a team. I want to learn to work with others. I want to be physically active. I want my child to learn to win and lose and become more resilient and deal with adversity and competition. Those to me, and this is where I'm kind of a homer for sports, like, that's the life lessons of sports that are super important, and I believe they absolutely positively happen. So I think if you're going in as a kindergartner that's going to play soccer, your goal is to go have fun, have social interactions with other kids, run around and enjoy activity, and start learning some neuromuscular control and body skills, body control and sport. It's not about winning. It's not about like playing up to 7 year olds and positioning yourself to be on the best select travel team. Um, that's where I think it is. So I think as you look at when is my kid ready to start sport, it's going to be a different answer for everyone. But it's, to me, the root of it all is setting that expectation. Because if there's unrealistic expectations from parent, child, coach, that's when things tend to go badly. It's not a great answer, but
Definitely. I lost you for a little bit of that, but I think I got
no.
the gist of it. We're getting closer to an hour now. I don't want to keep you too long. So, we've said a lot of great things in here. We've talked a lot about sports. We've talked a lot about concussions. We talked a lot about expectations and psychological aspect of sports. But I think the biggest thing is when it comes back to preventive medicine, you don't want to see a physician. You don't want to see us. So now that summer's coming, for us recording this today is May 14th. I don't know when you're going to be listening to this as far as our listeners here, but for us, summer's coming. What's the best way to keep kids out of your exam room?
Well, even before the exam room, summer's coming, which means it's getting warmer. Be aware of heat illness. And I'll say, like you, in the notes, I'll have a link to heat illness and kind of what it looks like, and when to worry about it. But it's increasing temperatures, increasing humidity, combined to increase risk for heat illness. Heat illness is absolutely preventable. And we hear about people that die from heat illness every year. That should not happen. So be watchful with heat, learn a little bit more about that. Um, Other things to do to stay out of our office in summer is some of it is just have good luck, right? Kids are going to be running around playing, wipe out and break their wrist, and that's just things happen. But as you look to summer, really remember, like, hey, you're going to be active, but find time to recover. So as more high schools go into unlimited summer contact hours, where now I do strength and conditioning from 7 to 9 in the morning with school, then I go to club basketball practice from 1 to 3, then I do football practice from 3 to 5. You are blowing by, that is like way too much use, rolling through recommended hours, like far past that. Those are things that I would ask families to look at and really kind of look at the AAP overuse injury statement, where I think the big rule of thumb is you want 1 to 2 days off a week, no formal training. If you're running around playing with your buddies, that's fine. Um, but during that time, if you are 13, you want to do no more than 13 hours a week of formal games, practice, training. If you're 16, it's 16 hours a week. So it's basically 1 hour per week per year of life. And that's a good rule of thumb because we think that injury rates really rise above that, and injury rates are fairly steady, acceptable, whatever word you want to use, beneath that.
Yeah, I think that's a pretty good rule. Um, we're frozen.
I don't know.
Oh, there we go. I think that's a pretty good rule, and it's a great one to follow. I think for our parents listening here, that they've gotten a lot of great information out of this, and hopefully, if there's some younger people listening to this as well, then they can take something away. I think as we get to the end of this podcast, there's once again a lot of great things, but if there's one thing that you really want listeners to take away from this, what would it be?
Yeah. So I'm going to hit you with more than one shocker, right? Because I love to talk. So I think sports are great. Love them. Life lessons, decrease risk of teen pregnancy, decrease risk of substance abuse, decrease risk of mental and behavioral health issues. But remember, as we talked about earlier, they can also be a source of physical and psychological distress as well. So point one, don't overschedule your kids. Really think about creating time for recovery. And as kids are working out, think about effective training and maybe looking at summer as a time to really build that core and overall fitness level. Um, Number two, make sure you talk to your kids. We talked about setting goals and expectations. That's a critically important discussion that you need to have on the regular, because when kids are younger, they may love swimming and you may love them swimming, but then they may change their mind and want to do soccer. And it might be because their friends are there, but that's okay. So, really have that repetitive conversation about goals and expectations with sports sets up positive association with exercise. And then point three, don't forget about free play and being a kid. One of the things that we have been losing is going outside and playing. And there's a variety of reasons for that. But the hard part is when you are out playing a game of pickup basketball with four friends and you're playing 2-on-2, and somebody gets tired or you get hot, you go rest and sit in the shade. Or if there's a ball that you're like, hey, that was out of bounds, maybe it wasn't. The kids need to talk, argue, figure it out amongst themselves. So it teaches you skills at solving problems. When you're doing that with coaches, and you're getting tired, they push you harder to train more. When you're doing that in the game, you have an official and an adult telling you that was in, that was out. So you don't learn those decision making and compromise skills. So that to me is the importance of free play as well. And then the final plug for especially high school athletes, get your sports physical early. So I really push people do that early in the summer. Don't wait until the last minute, because if there's an issue that maybe you need to see allergy or your blood pressure's high or something else is going on, you don't want to be behind the eight ball and not get that sports physical. And then you're not eligible to participate in fall sports, and that stinks. So really be proactive and get that physical early. But those are my good take home points.
Dr. Walter, thank you so much for your time. There's so much that we talked about in this that's applicable to children, to parents, to a lot of people from a pretty niche field that shouldn't probably be so niche because, as you said, so many million children doing sports, so many million are active. Everyone's going to get injured at some point. Hopefully, nothing catastrophic. But once again, thank you so much for coming on. And hopefully, we can keep in touch in the future as I continue on outside of residency.
Absolutely. Thank you so much for having me. I could talk for hours and bore your listeners to tears. So if you ever want me back,